Welcome to a Pedra publication presentation. Please note this presentation is an overview of a peer-reviewed collaborative study and is not a substitute for medical advice, diagnosis, or treatment. Any decisions related to medical care should be made in consultation with a qualified healthcare provider. This webinar, Clinical Features, Prognostic Factors, and Treatment of Interventions for Ulceration in Patients with Infantile Hemangioma, is presented by Dr. Esteban Fernandez Faith. If you have questions about this presentation or would like to give your own publication presentation, please contact us at info@pedraresearch.org.
Hello, and thank you for your interest in our study about ulceration in infantile hemangiomas. My name is Esteban Fernandez, and on behalf of our group, I would like to tell you more about this study, which was a collaborative study of the Pediatric Dermatology Research Alliance and was recently published in JAMA Dermatology. So what is the problem, or what is the issue that we studied? Let's start with a little bit of background of what we're dealing with. Infantile hemangiomas are the most common benign tumor or growth in infants and children. Approximately 4 to 5% of all infants will have a hemangioma, making this the most common benign growth or tumor in childhood. The first-line treatment option for hemangiomas that need treatment is propranolol, which is a beta blocker medication that we have been using for over 10 years now. Now, even though these are benign, hemangiomas can cause some problems in some patients. One of the problems that we see with infantile hemangiomas is ulcerations. These are open sores on the hemangioma, and these open sores can cause other problems. These are painful, there may be bleeding, there's a risk for infection. It can cause problems with daily activities, such as bathing, sleeping, diaper changes, eating, etc. And almost always, these ulcerations heal with a scar, yet causing another problem as the patients get older. Since we started using propranolol and other beta blockers for infantile hemangiomas, this complication, the complication of ulceration, has not been studied very well. So we wanted to better understand ulceration, especially now that we're using propranolol and other beta blockers. We had two main goals in this study. The first one was to try to figure out if there is one best treatment for hemangiomas when ulceration happens. And the second goal was to try to figure out if there were features of the patient or features of the hemangiomas that could help us predict how long is it going to take for that ulceration to heal. So that when we're seeing a patient and talking to the parents, we can provide better education and give them a better sense of how long we're going to be dealing with this complication. We teamed up with different hospitals that are part of PEDRA, of the Pediatric Dermatology Research Alliance, and we did a retrospective cohort study, which means that we looked back at the patients with an ulceration in an infantile hemangioma that we had treated, and we looked at a lot of different information to try to figure things out. So these are some of the results of our study. We looked at a total of 436 patients. One of the important pieces of information is at what age does ulceration happen? When should we expect ulceration to happen most commonly? We found that on average, ulcerations happen most frequently around 3 months of age. This graph shows the age of the patient in weeks. It shows that in most cases, ulceration happens early on. A little bit over half of ulcerations happened before 4 months of age, and over 80% of the ulcerations happened before 6 months of age. And this is very important so we can educate parents and caregivers better on when is the highest risk of ulceration in these patients. We found a group of patients, about 17%, who developed ulceration after treatment for the hemangioma was started. So these were patients who came in without an ulceration. A treatment was started for the hemangioma, and then an ulceration happened. This happened about 6 weeks after starting treatment and was more common in premature babies. What this means is that we cannot always prevent ulceration from happening even when we started treatment for the hemangioma. While we are treating patients, it is important to monitor for ulceration and to let parents know that ulceration may still happen. So the big question is, what is the best treatment? Or is there a best treatment option for ulceration in these patients? What we did was compare 4 treatment groups. We compared patients who were treated with wound care alone, patients who were treated with timolol, which is a topical beta blocker, Patients who were treated with a systemic or oral beta blocker, most commonly propranolol, but other types of beta blockers were used. And multimodal group. This is patients who had different types of treatments. Overall, when we look at all the patients, it took on average about 6 weeks for the ulceration to heal. Again, this helps us to better prepare parents and try to give them an estimate on how long it is going to take for that ulceration to heal. You can see for each treatment how long it took for that ulceration to heal on average. It took 4.8 weeks for patients who were treated with wound care alone, 5.1 weeks for timolol, 6.4 weeks for patients who were treated with an oral or systemic beta blocker, and 7.7 weeks for patients who were treated with multimodal treatments. When we look at the numbers, we can think that wound care and timolol were the best ones, that it took the shortest amount of time to heal with these treatments. But in reality, it is difficult to compare between the treatment groups. It is likely that we used oral medications, that we use oral propranolol, for example, to treat more severe ulcerations, and that is why it took a little bit longer in this group. In great part, the design of the study does not allow us to really pinpoint the best treatment between these groups. There are probably a lot of differences between the groups, which makes it difficult to compare. But when we look at the patients who were treated only with propranolol, we did find some interesting differences. We were very interested in comparing the dose of propranolol. In general, we could think that the higher the dose, the faster the healing is going to happen. But we actually found the exact opposite. We found that patients who were treated with a lower dose, meaning 1 milligram per kilogram per day or lower, these patients had much faster healing of the ulceration. Patients who were treated with higher doses experienced twice as long healing times. So in patients who have an indication for systemic or oral therapy, a consideration for treatment of the ulceration is to start at a low dose of propranolol and to titrate up slowly as the ulceration is healing. Now, the number of patients in this group was limited, and of course, this is something that needs to be confirmed in prospective studies. We need to do more studies to confirm this finding. The second question that we had was about prognostic factors. When we are seeing a patient with an infantile hemangioma that is ulcerated, can we predict how long is it going to take for that ulceration to heal? When we first looked at the information, at the data that we had, we found that ulcerations took longer to heal in preterm babies, in bigger hemangiomas, and bigger ulcerations. But when we looked at the data closer and did more analysis, the only factor that remained was the size of the hemangioma. This means that the larger the hemangioma, the longer it is going to take for that ulceration to heal. So what did we learn from this study? Ulceration may still happen even when we have started treatment for the hemangioma. We found that a low dose propranolol, meaning 1 milligram per kilogram per day or lower, appears to be better for patients who need an oral medication. And we also found that the size of the hemangioma matters to predict how long it is going to take for that ulceration to heal, with larger hemangiomas taking longer times. I would like to acknowledge all the collaborators through the Pediatric Dermatology Research Alliance. We are still learning about ulcerations in infantile hemangiomas. This is an important problem in our patients. We need to better understand it and to find better treatment options. Thank you again for your interest in our study.